Prevention isn't better than the cure. Prevention is the cure. Paying attention to your blood sugar health can be a life-saving move and save you decades of suffering from a chronic condition. For over 40 years, the Hypoglycemia Support Foundation has helped tens of thousands get off the blood sugar roller coaster. Let us support you in your journey to health today. Greetings, I'm Wolfram, and I'm CEO of the Hypoglycemia Support Foundation. I'm also someone who's struggling with type 2 diabetes. My challenge today is this. What if there was something you could do today that could prevent a chronic health condition 3 years from now or 30 years from now that could literally take over your life? What if there were signs like a canary in the coal mine that would indicate that something is amiss, to something you could do, an action you could take today to prevent a health condition, a debilitating health condition, many years from now? Well, I'm talking about low blood sugar. Dr. Seal Harris, who is the scientist and doctor who discovered low blood sugar, hypoglycemia, back in the 1920s, famously stated, "The low blood sugar of today is the diabetes of tomorrow." If only we'd listened. Today, over 50% of the U.S. is pre-diabetic or diabetic, and only 12% of the U.S. is considered to be metabolically healthy. For over 40 years, the Hypoglycemia Support Foundation has been working to address the profound disconnect between blood sugar health and your metabolic health and your overall well-being. We champion the idea that prevention is not merely better than the cure, but prevention is the cure. What is the market for our business? Well, only 12% of the U.S. adults are metabolically healthy. Blood sugar health is a leading marker for metabolic disease, including dietary factors such as overnutrition, undernutrition, and toxic nutrition. Metabolic disease, of which 75% is preventable, of which 75% is diet-driven, is a leading factor in the top 10 chronic diseases of our time. The Hypoglycemia Support Foundation provides a wealth of educational resources that reach tens of thousands of people every month. We provide a wide range of tools to help you understand how to improve your blood sugar health. Who is our ideal customer? You probably wouldn't even be watching this video if you didn't already suspect that government, healthcare, the food industry, the pharmaceutical industry don't have all the answers you need to be healthy. While we do have a hefty list of medical advisors, we are deeply rooted in the paradigm of patient advocacy. Our ideal customer is anyone interested in becoming their own champion of health and willing to become an informed advocate, whether for yourself, your friend, family member, or community. What is our traction? Well, we've been in this business for 4 decades now. That being said, we're always learning every day something new about hypoglycemia, low blood sugar, and blood sugar health, about metabolic disease. The science of metabolic health and nutrition is more advanced than it's ever been. We're enormously excited about having grown an amazing list of medical advisors, including folks like Dr. Robert Lustig, Dr. Keith Berkowitz, Dr. Asim Malhotra, Dr. Ann Childers, and many more. The timing couldn't be better. As you know, we're all facing a really challenging pandemic, but it's actually a pandemic on top of a pandemic. The metabolic health crisis has been in play for the last 4 decades. What we do know about COVID-19 is that everybody can get the virus, but your metabolic health, your metabolic status, your metabolic resiliency has everything to do whether you might survive around with COVID-19. So traction, there's all kinds of signs that the food industry, the health industry, and others are starting to pay attention to the health of metabolic science. And way back there down the stream is the canary in the coal mine of your metabolic health, your blood sugar health. one of these great indicators that could tell you early on that something's amiss. So listen up, visit our website, learn all you can. We might be able to save you some years of suffering or help you to survive the next pandemic that comes around.